G'day, Jeremy here from We Know Pets. Today I'm with Dr. Kay Weller from Bowral Vet Hospital and we're going to talk about paralysis ticks. Kay, what is a paralysis tick?
Well, a paralysis tick is a small parasite. The natural hosts are things like possums and bandicoots, but they can attach themselves onto our pets, dogs and cats. When they attach, they will obviously suck the animal's blood because they are a parasite, but they also secrete a toxin which can be quite dangerous.
And what are some of the symptoms to look for if you think your pet may have been bitten by a paralysis tick?
Okay, so in the initial stages you might just think that the pet's just not quite right, just a little bit different, something funny about them, but rapidly it progresses, so they usually get weak and wobbly back legs. Sometimes in a dog it might just be that we think they can't quite jump into the car, they might stumble or fall, but then it rapidly progresses to affect their swallowing muscles and their breathing muscles, and often they'll sort of give a little retchy type thing or a vomit, and you look at their breathing, they're just having a little bit puffy, trouble breathing, and that happens very, very quickly.
If a pet owner thinks their cat or dog has been affected by a paralysis tick, what do you recommend they do?
Very much call us straight away. There's no need to try to find a tick or take it out. Just call us straight away and come in. Unfortunately, even if it is the middle of the night and you think the animal has been affected by a tick, you come in because they can, tick paralysis left untreated, it can get progressively worse and the animal can die.
And what are the forms of prevention that you recommend against paralysis tick?
Okay, probably first and foremost, there's no one chemical which is 100% against ticks. You cannot put something on an animal and just guarantee it will never have a tick. So nothing beats a good search. You find 90% of them around the head and the shoulders. So you just run your hands through all around muzzles, ears, in between toes, things like that, at least twice a day in high risk areas. Of the chemical things, for dogs, things like Frontline or Advantix on the back of the neck every 2 weeks gives you pretty good protection. Always remembering with Advantix that it's lethal for cats. So even if you've got a friendly cat and a friendly dog, you have to worry about Advantix. For cats, the only product which has a label claim for ticks is Frontline spray, which you can apply every 3 weeks. But I often say if you value your relationship with your cat, they hate being sprayed, so Frontline top spot every 2 weeks is quite good as well. There's no label claim, but it certainly is effective.
And what about using a tick collar? Is that okay?
In low risk areas they're okay, but I would never rely on one.
Great, so for more information you can visit weknowpets.com.au.